In my last video, we covered the basics of what stem cells are and how they work. And today, we're diving deeper into a critical question that often gets overlooked. Where do therapeutic stem cells actually come from? If you're researching stem cell therapy or just want to understand this fascinating field better, knowing about different stem cell sources is essential because, and here's the key point, not all stem cells are created equal. Think about it this way. If you were building a house, you'd care about where your building materials came from, right? Are the materials new or recycled? Are they locally sourced or imported? Do they come with warranties? The same logic applies to stem cells used in therapeutic applications. The source of stem cells affects everything from how they're collected to how potent they are to what they're best suited for treating. As a pharmacist who spent decades in healthcare, I believe understanding these differences empowers you to ask better questions and make more informed decisions. Current research and clinical practice focus on several primary sources for therapeutic stem cells. Today, we're going to explore the four most common: bone marrow, adipose tissue, that's your fat, umbilical cord blood and tissue, and placental tissue. We'll also touch on some emerging alternative sources that researchers are investigating. Each source has distinct advantages and limitations. There's no universally best source. It depends on the specific application, the patient's age and health status, and what the therapy aims to achieve. Let's start with bone marrow stem cells because this is where the field began. Bone marrow has been used clinically for decades, primarily in transplants for blood cancers and immune disorders. This is proven FDA-approved medicine with a long track record. Bone marrow contains hematopoietic stem cells, which create your blood cells and maintain your immune system. It also contains mesenchymal stem cells, which can differentiate into bone, cartilage, muscle, and fat tissue. And here's how bone marrow stem cells are typically harvested. A physician inserts a needle into your hip bone, usually the iliac crest, which is that bony part of your pelvis you can feel. They aspirate or withdraw a small amount of marrow. And this is done under anesthesia, and while it sounds intense, the procedure itself is routine. Now for the practical considerations. Bone marrow harvesting is the most invasive of the common collection methods. Recovery typically takes a few days and patients may experience soreness at the extraction site. And additionally, research shows that the quantity and quality of bone marrow stem cells decline with age. A 25-year-old's bone marrow cells are generally more robust than those from a 65-year-old. According to comparative studies published in peer-reviewed journals, bone marrow contains fewer mesenchymal stem cells compared to some other sources. We're talking significantly lower concentrations. However, bone marrow-derived stem cells have strong osteogenic potential, meaning they're particularly effective for bone-related applications. Next up is adipose tissue, more commonly known as body fat. This has become increasingly popular as a stem cell source, and here's why. You have a lot of it. It's relatively easy to access, and it contains abundant mesenchymal stem cells. Adipose-derived stem cells are harvested through a minimally invasive liposuction procedure. A small incision is made, typically in the lower abdomen or back area, and a thin tube called a cannula is used to extract a small amount of fat tissue. The procedure is usually done under local anesthesia. Research comparing different stem cell sources has shown that adipose tissue contains a significantly higher concentration of mesenchymal stem cells compared to bone marrow. We're talking about numbers that can be 100 to 500 times greater per volume of tissue. That's substantial. The recovery from adipose tissue collection is generally easier than bone marrow harvesting. Most patients experience minimal discomfort and can return to normal activities within a day or two. The cells are relatively young and healthy because they exist in a dormant state within your fat tissue, experiencing less oxidative stress than cells actively involved in daily bodily functions. One interesting characteristic of adipose-derived stem cells is their particularly strong adipogenic differentiation. meaning they're especially good at forming fat tissue, which has implications for cosmetic and reconstructive applications. They also show promise in orthopedic and inflammatory conditions. Here's an important consideration. Because you're using your own cells, what we call autologous transplantation, there's minimal risk of immune rejection. Your body recognizes these cells as its own. Now let's talk about umbilical cord blood and cord tissue, which represent some of the youngest and potentially most potent stem cells available. After a baby is born, the umbilical cord, which is typically discarded as medical waste, can be collected and processed for stem cells. This is completely non-invasive and painless for both mother and baby. The cord blood is drained, and the cord tissue itself can be processed to extract mesenchymal stem cells. Research published in multiple studies shows that umbilical cord-derived mesenchymal stem cells demonstrate the highest proliferation rates among commonly used sources. They divide and multiply faster, which is significant for creating larger quantities for therapeutic use. They also show lower expression of senescence markers, essentially aging markers, meaning these cells are biologically younger and potentially more vigorous. Umbilical cord stem cells are considered immunologically naive, meaning they haven't been exposed to the environmental factors that mature immune systems encounter. This characteristic may contribute to lower rejection rates when used in allogeneic transplants. That's when cells from a donor are used rather than your own cells. The main limitation? Availability. You have to plan ahead and arrange cord blood banking at birth, or you need to rely on donor sources. Additionally, the quantity collected from a single cord is limited, though modern cell expansion techniques can often overcome this. For expecting parents, cord blood banking represents an insurance policy of sorts, preserving these young, potent cells for potential future therapeutic use. Many clinics internationally that offer stem cell therapy use umbilical cord-derived mesenchymal stem cells because of their proliferative capacity and immunomodulatory properties. Placental tissue is closely related to umbilical cord tissue and offers similar characteristics. The placenta, like the cord, is typically discarded after birth but contains rich sources of mesenchymal stem cells. Placental stem cells share many of the same advantages as cord-derived cells. They're young, they proliferate rapidly, they have strong immunomodulatory capacity, and collection is non-invasive. The placenta typically provides a larger quantity of tissue to work with compared to the umbilical cord alone. Some research suggests placental mesenchymal stem cells may have particularly strong anti-inflammatory properties, which makes them attractive for conditions involving chronic inflammation or autoimmune disorders. Like cord blood, placental cells can be banked at birth or obtained from donor sources for allogeneic use. Before we move on, let me briefly mention some alternative sources that researchers are investigating. These aren't as commonly used clinically yet, but they represent interesting possibilities. Dental pulp, yes, from your teeth, contains stem cells. Some companies now offer tooth banking, similar to cord blood banking. Menstrual blood has also been identified as a source of mesenchymal stem cells, offering women a non-invasive, renewable monthly source. Amniotic fluid, skin, muscle, and even peripheral blood are all being studied as potential stem cell sources. Each of these has unique characteristics, but they haven't reached the same level of clinical application as the four main sources we've discussed. Here's a critical concept to understand: the difference between autologous and allogeneic stem cell therapy. Autologous means using your own cells. This is what typically happens with bone marrow or adipose tissue stem cells. They harvest your cells, process them, and give them back to you. The major advantage? No rejection risk. Your immune system recognizes these cells. The potential disadvantage? If you're older or dealing with chronic disease, your cells may not be as robust or plentiful. Allogeneic means using donor cells, most commonly from umbilical cord blood or tissue. The advantage here is that you're getting young, potent cells in abundant quantities. The cells are processed and quality controlled in certified laboratories. The theoretical disadvantage is a small risk of immune reaction, though mesenchymal stem cells are considered immune privileged with lower rejection rates than other cell types. Both approaches are used clinically, and neither is universally superior. It depends on the specific situation, the condition being treated, and individual patient factors. So, what does all of this mean if you're considering stem cell therapy? First, ask your provider about the source of stem cells they use. This isn't just curiosity. Different sources have different characteristics and may be more appropriate for different conditions. Second, understand the harvesting process. If you're considering autologous therapy, know what the collection procedure involves, what the recovery looks like, and whether your age or health status might affect cell quality. Third, for allogeneic therapies using cord or placental cells, ask about the quality control measures. How are cells screened? What standards does the processing laboratory meet? Look for GMP certification, good manufacturing practice, which indicates rigorous quality standards. Fourth, recognize that younger cells generally have advantages in terms of proliferation and potency. But that doesn't automatically mean cord-derived cells are better for everyone in every situation. Autologous cells from your own tissue eliminate rejection concerns, which can be significant. Here's what current research tells us. Comparative studies show that while mesenchymal stem cells from different sources share fundamental characteristics, similar surface markers, differentiation potential, and immunosuppressive properties, they're not identical. Umbilical cord cells win in proliferation rates and youth. Adipose-derived cells win in abundance and ease of collection. Bone marrow cells have the longest clinical track record and strong osteogenic potential. Placental cells offer a good balance of many desirable characteristics. But here's the key. We're still learning. Research is ongoing to determine which sources are optimal for which specific conditions. The field is evolving rapidly, and what we know today will expand significantly over the next few years. Understanding stem cell sources isn't just academic, it's practical information that affects treatment options, cost, and potential outcomes. If you're exploring stem cell banking for a newborn, you now understand why cord blood and tissue are valuable. If you're considering stem cell therapy for a chronic condition, you can have informed conversations about whether autologous or allogeneic approaches make sense for your situation. Remember, reputable clinics will be transparent about their cell sources, processing methods, and quality control measures. If a provider is vague or dismissive when you ask these questions, that's a significant red flag. For those of you who want to explore this further, I've vetted a clinic that checks all the boxes we talked about: proper credentials, transparency, and quality standards. I've put the company information in the description below along with other resources. I've also compiled additional resources in the description below, including detailed comparisons of stem cell sources, questions to ask providers, and links to peer-reviewed research. I've also included information about how we at NuLifeSpan support your body's natural regenerative processes through targeted nutritional strategies. The more you understand about where therapeutic stem cells come from, the better equipped you are to evaluate your options and make decisions aligned with your health goals. If this information was valuable, hit that like button and subscribe for more evidence-based health education. Drop your questions in the comments. I genuinely read them all and use them to guide future content. And until next time, this is JD from NuLifeSpan, reminding you that knowledge transforms uncertainty into empowered decision-making.